Hi, it's Dr. Janowski for Sonata Aesthetics. We're going to do lip injections today. Lips are one of the areas where many people want to do lips, and a lot of people are afraid. They think it's going to hurt a lot. They think there's going to be a lot of recovery, and actually none of those things are true, at least the technique that we use here. So what we do is we put a strong numbing cream on the lip. It takes effect within just a few minutes. And I use very, very small needles, and I use what I call a micro-injection technique. We can use very small amounts around the lip. Gives us a lot of control, and there's very little recovery from this. There's hardly ever we follow everybody after the treatment, and they do not complain of bruising or swelling. Very, very little. Very, very seldom do we see that. So typically you can go out right out after your treatment and go about your day. So I'll show you how I use the micro-injection technique in just a second. The patient's numb with numbing cream now. We've got really just a nice shape to the lip. We just need volume. I look at, see how well defined the borders are, and her borders are great. So we just need to go in the lip itself and create some volume. And so we're just going to accentuate the nice shape that she already has. So you can see this is a very, very tiny needle here. Also, other things that help is I tap as the needle goes in like that. How did that go?
Easy.
Easy, yeah. So again, some of the important parts of injecting have to do with how fast the needle goes in and the size of the needle and how fast you inject. So again, I just move the tissue towards the needle and not the other way around, so we can actually just get that in super quick. And that really, patients don't feel that very much. It's when you go slow, when you see these injectors pushing the needle slowly, that's when patients don't like that. So we don't need to do a lip block or any kind of thing like that. Proportions of the lip are important. A classic proportion of the lip is everyone's bottom lip should be a little bit bigger than their top by about a third. A lot of patients, especially younger girls and women, are asking for a 1-to-1 ratio, which is not really a natural look, but younger patients can sometimes get away with that 1-to-1 ratio. I'm going to accentuate the corners of the Cupid's bow here. And so we've been just working on the top lip, and how's your comfort there?
Perfect.
Good. And then, so we've got 3 tubercles in the upper lip, 1, 2, 3, we want to accentuate those, and 2 in the lower lip, they're right about here. So I like to pinch the lip, come in from underneath, and create a little curvature. We don't want the lip to be just a straight line, we want it to be a bow shape, right? So we're going to create a little bit of that curvature in the natural tubercles, which create these 2 little bumps that are supposed to be in the lower lip. So as we age, we tend to flatten out, and we want to create a little more of that central bump, if you will, or tubercle or pillow. And we never want to overdo it. We know the lip is going to look a little bigger today than its final result. So we assess, our goal is really to get it a little bit bigger than our desired result, because we know it's going to come down. If patients are concerned about a lip that's going to be too big, we can split it into 2 treatments. You can see how easy the treatment is, so that patients can let the first half settle, and then we can put the other half in. She's already looking good here, and we're just going to go around and look for our gaps and create the tubercles, a little one in the central tubercle here. There's lidocaine in the product as well, so it actually gets more numb as we move along, and it gets easier as we move along for the patient. We want to make sure we keep that lower lip bigger than the upper. We never want it reversed. That would be very unnatural, and you've seen the fish lips or the duck lips on TV or even around town now, and that's not correct. It looks very obvious and unnatural, so we are always monitoring our ratio. Good. All right. We have just a little bit left, so the whole thing just takes a few minutes. You can treat lip lines as well. That's kind of a separate thing. She doesn't really have very many lip lines.
Can you get that guy right there?
Yeah, I'm already on it. So lip lines can be treated. And again, using this very tiny needle, we prevent lip lines from getting overfilled or the top lip looking overfilled. And so we're just going to put our last couple of drops, help the corners, and we're always looking for symmetry as well. If there's something looks asymmetrical, we try to fix it. So that's the whole treatment. Open just a bit. And keep your mouth loose and just a little bit open, and I'm just going to massage. You can see there's no bruising currently. Yes, it's possible to bruise a lip, but it's not common with this technique at all. We want to avoid alcohol before the treatment, and ibuprofen and fish oil, vitamin E, those kinds of things. And so now we just let it settle and put a little cream on it and we'll be done. So you can see the lip has nice proportions. It's not overdone. We have accentuation of the bow shape, open, and we've got good normal proportions to the lip, and patient can literally just go right out back to work or whatever they're doing. And if we need to add more, we can. Some patients need more than one syringe, but typically one syringe is sufficient for most patients. So that's the microinjection technique for the lip.